Hi, welcome back to my channel. So I actually wanted to go in a little bit more detail about being a CNA and what that means. So in my first video, I talked about how to become a CNA, and in this one, I'm actually going to talk about what it means to be a CNA, what you can expect in terms of pay, your schedule, and things like that. So I actually have some notes here, so I'm going to look down from time to time, but for the most part, I'm super excited to be able to bring you this information. So the first one, I was a CNA for 4 years before I became a nurse. Um, the shifts, they can look a little bit different. So for instance, you have morning shift, you have, which is called day shift, you have evening shift, and then you have night shift. And I worked all three of them. So I think I have a really good comparison in terms of how the shifts are. So the morning shift is really you're getting the patients up. You're feeding them, you're dressing them, you're getting them ready to start the day. They might have activities for the day. The patient may have a shower that day. So the first thing you're going to do is you're going to get a report from the other nurse or the other nursing assistant. Um, they're going to tell you how the patient did that night, if they had any complications, if anything changed. Um, if you know the patients, then you probably already know a lot about them, so it could be pretty quick. If you don't, then it might be more lengthy. A lot of the times the facilities will have you to go from room to room so that you can actually physically see them. Another thing that I'm going to go into is that you want to make sure that your patient's actually been changed. That means if it's a patient who doesn't know when they need to go to the bathroom, for instance, they're incontinent of bowel and bladder, meaning they don't know when they need to pee or they don't know when they need to poop, then you want to make sure that that patient has actually been changed by the night shift. Or if you're going on to say the evening shift or whichever shift you're coming on to, you want to make sure that that CNA has done their job, and that so because if they haven't, then you're going to take responsibility for making sure that that patient has been it's going to take you more time to get your day started or to get your evening started or your night shift started. So that's number one. Number two is the patients have to go to breakfast. So sometimes the nurse might have to give them medication, so you'll have to either wait for the nurse to give them medication because the medicine has to be given before they go to breakfast, or it's always possible that the patient can just go straight to breakfast. And you'll know, especially if you've been there for quite a while, when that patient is actually needing to wait or they can go straight down. Sometimes the patients might actually eat in their rooms. So that means you get them set up in the bed, you can brush their teeth or help them to brush their teeth or get them set up to do that. Um, then you have to wait for the breakfast trays to come. And that means they're going to put it on a cart and they'll bring it down and you have to hand it out. A lot of times they'll have like the patient's all the time. They'll have the patient's name, birthday, and also their room number on that tray, the type of food that they're supposed to have, whether or not it's a regular meal, meaning that they don't need any special accommodations, like they're not diabetic, they don't have high cholesterol. Sometimes the patients are actually on puree. That means that the patient doesn't have teeth or they can't chew or they might have a swallowing problem, and you want to make sure that that matches up. The other thing is that the patient may have issues swallowing water. So if they do, then they might have a thickener. That thickener is basically, it could be cranberry juice, orange juice, water, any of those things. And what that means is either the dietary department has already fixed it and it's already thickened, and it might even have an N on it for nectar, or for however the consistency thick it needs to be. So if someone has a problem swallowing, what that means is they can't drink regular water. The consistency of it when it goes down could go into their airway. So the thickener makes it easier for it to go down the right way. I can't even believe I just thought, I didn't even have that on my list, but I thought of it because I just remember uh, being a CNA in 2003. That's when I graduated high school, 20 years ago. But being a CNA and looking at those trays and just, or even handing them out, because you can work together with your other, hall partners is what we call them. You work together and you say, hey, this is, room 212, bed B, that's the one by the window, or bed A, that's the one by the door. And then you hand the trays out, and then, but you got to make sure that that matches what the patient is actually supposed to be taking. And it's really, it's really the dietary's job to make sure that it's correct, but it's still important for you to have an understanding of what that patient what diet they're supposed to be on. This gets a little bit deep, but it should be on their care plan, and that's something that the nurse comes up with the doctor, and they should review that once a month. But we're not going to get into that until we start talking about being an LPN and RN, which I was all of those things until I became a doctor. So, or got my doctorates as a nurse practitioner. So that's the morning shift. Throughout the day for morning shift, typically you're going to put the patient down for a nap. If they want to have a nap, there might be activities during the day you'll have to take them to. Family might come in to visit, so you want to make sure that they're ready to go for that. In addition to that, around 3 o'clock, depending on your facility that you work in, around the afternoon time when the next shift comes, now you're going to give them a report. You're going to make sure that the patients change. They need to be changed at least every 2 hours. Sometimes the patients have to be repositioned, and this goes for all shifts. The patients need to be changed at least every 2 hours. They need to be repositioned, meaning that you are making sure that they don't get bed sores. In addition to that, they have snacks throughout the day. You want to make sure that they're being well hydrated, so you're giving them a lot of water. The nurses are going to want vital signs, so typically you're always going to do that at the beginning of the shift, and then you might have to do it more frequently throughout, especially if they have to have medications that require for them to have their blood pressure checked or their blood sugars checked beforehand, and you're going to be doing all that for the nurse. As a part, and that's throughout all of the shifts. So if you're on 3 to 11 or the or the evening shift, that could be from 2 to 10, 3 to 11. The process is kind of still the same, except for now the patient's going to dinner. So they're maybe down for a nap, and then they're going to go get ready to, you're going to get them ready to go to dinner. You're going to be changing them throughout the shifts. You might have between 8 and 12 patients. Sometimes you might have 6, sometimes you might have 14. It just depends on the day. It depends on if someone called off, and that's all shifts. Your evening or your night shift, that typically is going to be from 11 p.m. to 7 a.m. or 10 p.m. to 6 a.m. And what that looks like is a lot of the times the patients are, they're sleeping. Sometimes they're not, but you're still going to change them every 2 hours. Obviously, you're not going to be necessarily feeding them like you would during the day shift, and then you get off. And again, you want to make sure that the patient's been changed before you leave. You want to make sure that they were changed even when you got there with the other nursing assistant. Now, depending on where you work, you can have different shifts. You can have 8-hour shifts, 12-hour shifts, or even 16-hour shifts. I really like 16-hour shifts because if you want to work two days out of the week and just get your 32 hours done, then you're done. If you want to pick up overtime, then you can pick up overtime. I'm just looking down at my notes. Being a CNA, obviously that's just in the nursing home that we talked about, but there's so many areas that you can work in. You can work in the hospital. A lot of times those are 12-hour shifts. You can work in the office. That is typically Monday through Friday, off all major holidays, and it could be from 8 to 5, 9 to 5, 9 to 4. And then you can work in a dialysis center, you can work in home health, you can work in as a sitter, you can work in skilled nursing facilities, you can even work in an agency. And an agency is where you don't have a set shift, you can actually pick what days you want to work. And a lot of times you're going to get paid a lot more. So that's a good segue into pay. Being paid as a CNA really depends on where you work. Is it a hospital? Is it a nursing home? You can range between $11 an hour, and that's like the most base rate pay. I'm in Florida, so it can range from $11 an hour to $15 an hour, or even up to $30 an hour. And the $30 an hour is really if you're doing agency or you're doing travel CNA. What agency is they don't have the staff in their facility to take care of the patients, and so they pay you a lot more money to come in and take care of the patients, okay? So for me, I kind of went into, so I worked in the skilled nursing facilities and I loved it. I stayed in skilled nursing facilities. Even I was a CNA, an LPN, an RN. I was a director of nursing. So I went all across the board in terms of being in the skilled nursing facility. So I did transition into hospital nursing, which I love that as well. I was a hospital nurse for about 5 years before I got my master's as a nurse practitioner, and then I went into the office setting. So I'm really excited to have brought you this information. If you enjoyed it or if you got something out of it, then please like and subscribe. I will be bringing you these videos at least once a week or every 2 weeks, just to give you more information on how to. In this series, it is how to become a CNA and how to kind of basically the life as a CNA. What do you do? How can you do it? How much you're going to get paid, and what that looks like. So if you have any comments, please leave them down below. I would really love to hear that, and even your experience. So I look forward to seeing you in the next video. Bye.